why is my anterior hip replacement so much more troublesome than the posterior one? Well, it's difficult to comment in individual cases, but let's be very clear. The anterior approach is very new. It's not as tried and tested. It may be that you're going through a learning curve with the surgeon, okay, that he's trying to learn this to look different. The posterior approach is already the wheel invented. So why reinvent that wheel? We can get a fantastic recovery with the posterior approach. And really, it's very simple and straightforward. Patients can go out the same day. So what are we improving on with an anterior approach? With regard to restrictions on the anterior and posterior approaches are all as good. We put them on for precautions, but honestly, if I put it in right, the very few restrictions are actually needed. We know these things aren't going to come out if you put it in right, regardless of the anterior or the posterior. So there actually is no added benefit. In my view, it may be even a little bit more risk operating in and around the groin area. And maybe there's a little bit more stretching of tissues to get things in. But that's my personal opinion. And obviously there will be people, anterior approach people would say that's different. But look, it doesn't matter. Just get the surgeon doing it well, wherever it goes.